Welcome to Day Surgery at Lenoir Memorial Hospital. Thank you for choosing us for your surgical needs. This video is designed to provide important tips that will make you and your family more comfortable and help avoid unnecessary delays. You may have already met one of our Lenoir Memorial Auxiliary staff volunteers. All of our patients check in with the volunteers on arrival to day surgery. They are a wonderful asset to our department, and they can provide you with much information and direction. Your next stop will be our registration staff. They will ask you about your personal information that may have changed since your last visit. You will need a picture ID. The registration staff should also be informed if you are on medication for high blood pressure, diabetes, heart, or lung conditions. These medical conditions will require special testing. Informing them of these conditions will ensure that all the blood work needed will be done. Patients may receive several phone calls from the hospital prior to surgery to make your visit to the day surgery center as convenient as possible. Some patients may be required to come in for a preoperative testing, and others may not. A day surgery center nurse will instruct you over the phone, or your physician will instruct you on whether or not you need to come in for preoperative testing. If you are 50 or older, you will need to have an EKG if there's not a current one on file. This is a tracing of the electrical activity of your heart and will be done in the cardiopulmonary department. That concludes your pre-surgery registration. It is very important that you call the day surgery registrar after 3 p.m. the day before your surgery to find out what time to arrive the morning of your surgery. The operating room does not finalize the schedule until late in the afternoon of the day before your surgery. By calling ahead, you will actually shorten the time you have to wait before your operation. Also, it is important to let your surgeon know if you become ill, develop a fever, have a cold or flu, etc. prior to the surgery date. The surgeon may choose to reschedule your surgery until after you are feeling better, both for your safety and your comfort. There are also a few things you need to know before coming back the day of your surgery. One of the most important things is that you need to have nothing, absolutely nothing, after midnight and until after surgery, unless you are otherwise instructed by your day surgery center nurse. Following these rules will make sure that your operation will go more safely and smoothly. Also remember that no water, candy, or chewing gum can be had the morning of your surgery. You should also not take any medication the morning of surgery unless you are given specific instructions by the anesthesia department. This includes insulin. Please understand that these instructions are only in your best interest and safety. If you do drink or eat the morning of surgery, this fluid or food could enter your lungs while you're under anesthesia and cause significant problems. No matter how little you drink, your stomach creates gastric juices which are extremely acidic even with just a small amount of liquid. So as you can see, it is very important that you follow these instructions totally. Another very important point is the morning of surgery you should arrive wearing a minimal amount of loose and comfortable clothing. On arrival, the first thing you will be asked to do is to remove your clothing and place a hospital gown on. It is time-consuming and sometimes difficult for you to take off several layers of clothes and work boots, etc. So why put them all on just to have to remove them once you get here? Also, after surgery, you probably will not feel good and may not want to do a lot of pulling and tugging. In addition, keep in mind the type of surgery you are having. For example, if you are having an abdominal surgery, a female may want to wear a loose button-up dress or gown or loose jogging pants. For leg surgeries, you will want to wear shorts if the weather permits. Breast surgeries will need button-up shirts. Also be sure to bring comfortable slip-on shoes, no heavy shoes or boots. Here are some other tips that will make your surgery here at Lenoir Memorial just a little more pleasant and easier for you. Please leave your valuables at home or with a family member. Do not wear makeup or any jewelry the day of surgery, including rings. Body piercings need to be removed prior to arrival as they are time-consuming to remove at times and could delay your surgery. Do not wear any fingernail or toenail polish. You will be asked to remove the first 2 fingernails on each hand if you wear sculptured nails or acrylic overlay. We need to observe your nails for monitoring your oxygen level. You will be asked to remove glasses and/or contact lenses prior to surgery. Also, you will need to remove any dentures or partials prior to having any sedation. If you wear hearing aids, they may also need to be removed. This will vary from surgery to surgery, so we request you wear them. Then please notify your nurse and we will discuss it with the anesthesiologist. You will need to bring all of your medications that you are taking, even if your doctor has seen them. Remember, you will not be allowed to drive yourself home. You must have someone to drive you. Your surgery will be canceled if you do not have someone with you to drive you home. You will not be allowed to take a cab home unless you have someone to ride with you in the cab. So please make arrangements before the day of surgery for your transportation. Remember, you should not stay by yourself for at least 24 hours after your operation. So it is very important that you plan for your care at home before your day of surgery. Only blood parents or legal guardians are allowed to sign for pre-op testing and surgical consents. Okay, those were some tips for you as a patient. Now, here are a few tips for your family or friends who are waiting for you. Our waiting room can be cool at times, so a light coat or sweater may be needed. They may be waiting for an extended period of time and may need to bring a snack or money for a meal in our cafeteria or snack shop. Tell them to bring something to read or maybe a game to entertain them while they are waiting. There's also a television in the waiting room that is shared with all visitors. Again, you will need to call the day surgery registrar the afternoon on the day before your surgery. If your surgery is on a Monday, you will call them Friday afternoon after 3 p.m. If you have not been contacted by a day surgery center nurse, please inform the registrar when you call the day before your surgery to find out what time you need to report to the day surgery center. Your arrival time on the day of surgery will be approximately 2 hours before your actual surgery time. This gives us time to prepare you for the operation. All of our surgical times are estimates because at times a case may take longer than we had anticipated, and we do have emergencies at times. We are eager to assist you on the day of surgery and want you to have as safe and efficient experience with us as possible. By following these tips, you will help avoid patient delays and pitfalls. Oh, and please be sure you read your day surgery pamphlet. If you didn't get one or the special soap at your physician's office, please make sure to pick them up prior to your surgery from the Day Surgery Center front desk or your physician's office. This will be a great reminder of things needed to be remembered. So thank you again for choosing Lenoir Memorial Hospital Day Surgery. We look forward to working with you. Funding for this educational video was provided by the Lenoir Memorial Foundation.